Good afternoon, everyone. Thank you for coming. The COVID-19 situation continues to evolve. As you know, last evening we learned of our first presumptive positive case in this province. The woman returned from travel on a cruise ship and she is currently self-isolating. Public Health has notified the patient and contact tracing has been initiated. The patient is from the Labrador-Grenfell Health region. Although due to privacy concerns, I cannot release any more specific details than that about the case. Our public health officials are well prepared and working diligently to respond to any cases that arise. And our regional health authorities are also prepared to respond. As of last night, we have 121 people in isolation across the province. And as of this morning, we have tested 161 people, and of those, 105 are confirmed negative. We are awaiting the results of the remainder of the tests from the National Microbiology Laboratory. In light of the first presumptive case, I appreciate that there is concern about how to protect ourselves and our families from this virus. We have to remember that 80% of people who have this virus have a mild to moderate illness and will recover quite well. Only about 5% become more seriously ill. And while we expect that there will be more cases, all of the measures put in place so far around self-isolation, international travel, postponing and cancelling mass gatherings, and social distancing will help to alleviate the spread. The evidence tells us people are contagious when they have symptoms, and if someone has been in contact with an individual before they become sick, they are unlikely to become infected. But we do advise that people self-monitor if you become ill, to call 911. Sorry, 811, don't call 911. 811 does have a backup of calls right now, lasting over 24 hours. They have additional staff to help alleviate the wait. We thank the public for their understanding in this unprecedented situation. If you are finding it difficult to cope or feel anxious, speak with a trained mental health peer support by calling the Provincial Warm Line at 1-855-753-2560, open 9 a.m. to midnight. If you are experiencing a mental health crisis, call the Mental Health Crisis Line, available 24/7 at 1-888-737-4668, or use the crisis text service by texting 686-868. Please know that you are not alone, and I encourage you to visit bridgethegap.ca to view the many options available to support you and your well-being. An online self-assessment tool through www.811healthline.ca will be accessible by the end of the day so that you can determine your risk for COVID and whether or not you need to have testing. We all have a part to play, and while there may be some disruptions in our lives, we need to all work together and help as many people as possible stay healthy. Thank you.
Just looking to confirm, we still only have one presumptive positive case in the province?
Yes.
There's been no more since then?
No.
Okay. And that woman, we don't have an age range still?
No, due to privacy concerns in small towns.
Other provinces, PEI only has one presumptive case, and they're allowing most information. She was in her 50s, returned from a cruise on March 7th, lives in a certain area. Is there at any point the province is going to open up some of these, I guess, restrictions and allow us to know the regions when people return?
So we all have different privacy laws, so we have to be in keeping with ours.
A lot of people are concerned about schools on Tuesday. And we've seen other provinces like New Brunswick, which also has one case, not opening schools. Why are we, as of now at least, still planning to open schools on Tuesday?
So school closures are certainly something that we've all been discussing. At the moment, many of the places that are closing schools are doing so because people are traveling back from their March break. So the 2-week closure is to wait out that incubation period that needs to happen, so that the children aren't in school and aren't contagious at that time.
Some of the people in this province are wondering about ferries and transportation on them. Right now, protocol is to get out of your vehicles on those ferries. Are we not enacting something so people stay within their vehicles to help reduce spread?
Those are questions that we actually have to take to, we have to be in compliance with Transport Canada, so there are some laws in place about that, so I can't give you a definitive answer on that right now.
Back to the issue of schools, are, for example, things like recess or lunch periods are a time when a lot of students may be gathering together. For example, cafeterias, places like this. You may get hundreds of students, which would seem to kind of go against the advice to not have groups of more than 250 students. Is there specific advice that you're giving to schools to be able to reduce their risk even if classes are going?
So certainly we've been talking with schools, and schools are aware of ways that they need to reduce that sort of mass gathering effect. And so those social distancing measures every school is different, so those would have to be left up to certainly the school district and individual schools perhaps to be able to determine what would be the safest way to go.
We have an elder population here in the demographic. In terms of visiting those that are elder, visiting the hospital, what restrictions are in place right now?
So right now we're asking anyone who's come back from international travel to not visit long-term care facilities, hospitals, personal care homes for at least 14 days after they get back. We would also ask, of course, if anyone is having any symptoms of an influenza-like illness or cold symptoms, that they stay away from visiting vulnerable patients. COVID-19 is not the only thing that puts them at risk at this time of year, so certainly important to try to protect the most vulnerable in our population.
And the 14-day self-isolation, that's for anybody who travels outside the province, not just the country.
So what we're saying is anyone who's traveled outside the country, yes, and anyone who's traveled outside the province, especially if they have attended mass gatherings that may have had international attendees.
Any word for those that are ignoring some of the recommendations for social distancing right now in terms with St. Patrick's Day celebration?
So we would certainly recommend that people, practice their good civic duty and make sure that they try to distance themselves as much as possible, keep their hands clean, wash your hands frequently, and if you're sick, stay home, cough or sneeze into tissues or into your arm, and try to reduce the spread of any illness as much as possible.
The Ordinance yesterday released said it would be compensating private business workers, but in that release they said anyone coming home from travel must self-isolate. Is there some kind of enforcement measure in place?
So we're asking that people do that. It's certainly been advised that they do that, yeah, so.
Other provinces have made it mandatory upon return to self-isolate. Why have we not made that mandatory?
So mandatory is, it would require enaction of different laws. At the moment, those things are all part of the discussion. People have been compliant up to this point. Most people, I think, are quite conscientious and want to ensure that they don't cause illness in other people, particularly in vulnerable people. And I think, this province, I've lived in it most of my life, and I can say with confidence that we look out for each other, and I trust that Newfoundlanders will make the right decisions.
If someone has a compromised immune system, they have a pre-existing condition that may make them more vulnerable, especially to ending up with a more severe case. A lot of people are wondering, well, what should I be doing then in order to protect myself?
So certainly if you are somebody who is in a more vulnerable group of people, we would recommend trying to limit your interaction with other people, and that can be difficult. It can have a lot of other impacts on your life, but to try to stay away from crowds as much as possible, if you can have somebody go out to get your groceries or to get things that you need, if you can work from home, to try to do those things to reduce your risk for being exposed.
We've seen other provinces like Quebec, for example, today taking much more drastic measures in terms of ordering all gyms and even things like bars and restaurants to close. Why are they taking that measure and yet we have much more relaxed measures?
So Quebec is in a bit of a different situation than we are with the number of cases, and certainly as our situation evolves, we will have to change some of the things that we are doing as well, and those are things that we can only do as we monitor the situation.
How serious should people be taking the situation right now?
So I think everybody needs to be concerned. We've obviously seen a lot of spread of this disease in the last week, and I think people need to be cautious, people need to be making sure that they're practicing social distancing measures, avoiding large crowds, washing your hands well, staying home if you're sick, to make sure that we reduce the spread of any potential viruses, but certainly to reduce the risk of spread of COVID-19.
Is testing only effective once symptoms have begun to show? There's no point in testing until symptoms are present?
So people have been tested prior to having symptoms in some situations, and they have been shown to be positive. But generally speaking, the best results from the test are when people start to develop symptoms, because that's when they're shedding the most virus. So that's why we limit our testing to symptomatic people at this point.
We've seen the province has decided to close performances at arts and culture centres, but yet there's been no directive for private movie theatres, for example, to do similar means. Why the discrepancy?
So those are discussions that are ongoing with, and obviously discussions with private businesses that would have to happen outside of myself as well. But so those are discussions that are ongoing.
There's been concerns raised about poison gold mine in that site. There's lots of people from all over the country, all over the world, to go in and out to work there. Is there anything in place at all there, or any concerns brought to you about the mine?
Well, certainly at this point now, anyone who's traveling from outside of the country would have to self-isolate for the 14 days. Those same rules would apply there as they do everywhere else. But and Boise's Bay, I'm sure, has measures in place to make sure they limit contact and social distancing and all of that.
We now have one presumptive positive case here. That person, I'm just going to gather that they didn't travel on their own on this cruise. For those that were alongside or in close proximity at this point, aren't showing any symptoms?
So the details of the investigation are still ongoing. So any people who were traveling with that person certainly will be contacted by public health and will be examined to see if they have any symptoms. If they have symptoms, they will be tested.
Now, what about individuals though who would have been traveling on the plane with that person? They may not have known the individual. This person presumably flew back to the province, would have been seated with other people around them. How far are you going in terms of contact tracing in order to, will people on the same plane, for example, be contacted and tested?
So there are recommendations for how we do contact tracing on a plane. And generally speaking, it's people within a 2-meter radius of the person if they were symptomatic when they traveled.
Do you know, was this person symptomatic when they traveled?
So as far as I know right now, the person had some mild symptoms when they traveled, so that process is ongoing, that contact tracing process.
Can you explain the difference between presumptive and the confirmed positive testing?
So presumptive positive is the test that was done at our lab, came back positive, and then we have to wait for the confirmatory test from the National Microbiology Lab.
How often is there a discrepancy? People are wondering, how good is the test here compared to the one at the National Microbiology? How often might you have one that is maybe negative here but positive there, or vice versa?
So we haven't had a lot of specimens that have gone up, and so we would only know that over time. But our test, it's just a bit different than the one that they're using at the National Microbiology Lab, which is a little more sensitive. So that's why we wait for the confirmatory.
The movement of the spread and all the precautions being taken, obviously, to flatten the curve. Right now, we're seeing a peak in other countries. Do we have a timeline or an estimated, timeline on when we potentially could see the peak in Canada?
No, at this point we don't. We're still working very hard on containment and making sure that we limit the spread of this disease. And if we can enact some of these measures and learn from what other countries have done, then we may not see the same peak. So it's difficult to say that at this point.
There are a lot of people who are really worried about this, and they're saying, maybe closing schools, closing down public gathering areas, why not just say, let's do this now, and just to be on the safe side rather than waiting until we have some more cases or we've seen community transmission?
So when you're thinking about doing things like closing schools, you have to consider when is that going to have the most impact. If you do that too early, then you have kids out of school for a very long period of time, and it may not have the full intended response. The other thing about keeping children out of schools that you have to remember is that somebody has to look after children when they're out of schools. So then you might end up with grandparents taking care of children and then their grandparents being in a higher risk category. So those are all things that you have to consider when you're making these decisions. So it's not just as easy as saying, let's shut down the schools. There's a lot of considerations we have to put into place. And if you do it too early, it might not have the intended result that you want.
Does the closing of MUN change that at all?
So Memorial is able to do online instruction, and that's very good. That will be a much more difficult thing to do in schools. And so certainly MUN closing, their aim was to try to reduce spread within their classrooms and to put in place those social distancing measures, and they had the ability to do that.
Other countries are taking the approach of certain age groups not interacting with the other, saying anyone under the age of 12 not interacting with anybody over the age of 65. Is this an approach we should be looking at doing?
So those, certainly we would recommend, as we move forward, we're recommending anyone who's in a vulnerable group to try to limit their exposures. So that would not be an unusual thing for us to do. But those are all part of ongoing discussions about how we should respond.
Self-isolation can be pretty mentally taxing. What should people be doing, I guess, to stay positive throughout such a difficult time?
So, yeah, and that is a really difficult thing, and I appreciate that asking people to stay at home for 2 weeks and not go out and not have friends over, that can be very difficult. But we, a lot of us do have social media or, FaceTime, those sorts of things that we can avail of to talk to people. I would recommend as much as possible before we get more cases or before we see increased spread, perhaps, that people maybe look at some of those social supports that may be available in the community to be able to avail of, to make sure that they have people who may be able to drop over food or to go do other errands that they might need to do. Try to get those support services in place beforehand.
Now that we have our first presumptive positive case here in the province, how many more are you expecting in the coming week?
That will be a very difficult thing to say at this point. If we have close contacts of this case who are symptomatic, then that certainly, raises the possibility that we might get more cases who are close contacts of this case.
I guess, are you expecting more presumptive positives?
I think we will be expecting more presumptive positives. I mean, this is a very popular time for cruise travel. We know that there's been a couple of cruise ships that have had positive cases, so I would not be surprised to see more positive cases in those circumstances.
A lot of people are looking at places like Italy and China where there have been an extraordinary number of cases and also extraordinary measures. What sort of lessons have you learned from the experience there, and I guess what are we doing differently here to make sure that we don't end up in a similar situation to them eventually?
So certainly with regard to China, the team that went in, the World Health Organization team that went in, found that those public health measures that they used, so the social distancing measures, the contact tracing, isolation, quarantine, all of those things that they used, not so necessarily the bigger measures that we saw about them shutting down airports and all that, although that certainly helped for it to reduce the spread around the world. But to reduce the spread from Wuhan and the Hubei area to the rest of China, those public health measures really did have an impact. And that's why we're focusing so much on those right now. And I think we've learned that seeing the spread of it elsewhere, especially in Europe, I think federally they recognized that it was important to make that recommendation about people isolating after their return, because travel seemed to be a big risk factor.
Government officials were told to not travel for work. This was only Wednesday last week. We've now since had some that decided to go on vacation on Thursday. How are residents of the province supposed to take some of these advisories seriously when it seems like our government officials aren't?
So I would advise that people need to, to really seriously consider their travel. I would not recommend that anybody fly internationally at this time, but it's difficult to comment on.
Other provinces like Ontario have instituted billing codes to allow family doctors to be able to call up and deal with patients virtually. Right now, there's no way for a doctor to be able to get paid if they are dealing with a patient who's in self-isolation, for example. Why hasn't Newfoundland and Labrador followed that same path?
So I believe some of those discussions are ongoing. I don't have a specific answer for you for that, though.
You mentioned and you said that that presumptive case was in Labrador-Grenville Health. Labrador-Grenville Health also spans into St. Anthony area. Can you confirm whether it's here on the island or in Labrador?
So at the moment, I can only go as far as to say Labrador-Grenville Health.
You mentioned schools in other places are closing because of March break. We have an Easter break coming up. Do you foresee the possibility that we would do the same thing under the same logic?
That's certainly discussions that we're having, and I think we would be open to that discussion. We're hopeful that most people will decide to rethink their travel plans and will not be traveling by the time Easter comes.
Can you expect another update tomorrow?
Yes. Okay.
Thank
Thanks,
you very
guys.
much.
Thank you.
Just in time for somebody else.